2, 1. Okay, so we're here today to talk to you a little bit about some of the things you can do at home to help support your pelvic floor. Many of you may be hanging out at home a little bit more and maybe a little more sedentary, and maybe even, developing some back pain or hip pain or, leg pain or anything like that. So I'm just going to go through a few different techniques that you can use to support yourself in your pelvic floor if you're unable to make it into your appointments. So this is Dr. Megan, and she's going to be our model, and I'm Dr. Lisa, and we're here at Amber Wellness Group. So the first thing that you want to do is, when you're looking at the muscles of the pelvic floor, a lot of times are held in a contracted state. And so when a muscle's held in like a 70% contracted state, it has a really hard time relaxing. So one of the best ways of getting that muscle to relax is to take it to end range. So if you're laying down, one of the things you can do is bring your leg up like this. And when I'm in the clinic, what I have patients do is I have them press into my hand like this, and then I resist back and try and move them in that, and then I let them take a break, and then I move out to another angle and have them resist into me. And so what we're doing is we're taking not only the psoas, but we're also taking the piriformis and the obturator, do it again, into a little bit of a contracted state. So we can do that, and then we can relax that muscle a little bit. And then you can do that at home by grabbing your own shin and then pressing into it and doing to a count of 10, 9, 8, all the way down into 1, and then maybe taking a break and then coming out and doing it again. And again, you're just trying to get the muscle to go from this contracted state like this to a full contraction so that it can actually relax. So you get all that, and then we do the opposite. So then you can let go up there, and we can pull into this, and we hold, 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 and then we move it out to another angle and do that again, and then out again. And you might find that you have strength or weakness in different areas. And so you can do that yourself by pushing on your leg, and again, doing it for a count of 10, and then going out into the different angles. You might have to move your hands around in order to support your leg so that it doesn't fall over. So those are some quick exercises. I like people to do those before they get into a stretch, because when you get into stretching, if your muscle's in a contracted state, sometimes it doesn't want to stretch into a relax. So if you can contract it and then relax and then do your stretching, like doing your psoas stretch. There's a couple ways of doing a psoas stretch. If you scooch all the way over to the side of a bed and then dangle your leg off, you can get a really nice stretch on the psoas here. Can you feel that? Mm-hmm. It's really nice. And you have to have a tall enough bed in order to do that. And then you just let your leg hang in a dependent way. Another way to do a psoas stretch is to lean back, and the back foot, and you're leaning back, and your front foot is just kind of a tripod to hold you in balance, and the back foot is where you're stretching the psoas. Or you can be down on one knee and really stretch that out. The other stretch that's really important for back stuff is the piriformis. You want to turn around and sit up and show your figure 4 on this. Oh, sure. So the piriformis is this muscle that you can stretch really easily just sitting down in a figure 4. The piriformis is inside this pelvis here. It's coming right in through this foramen here, this hole. And one of the ways that we feel the piriformis is when we get nerve pain down our leg or sciatica. And we can get a lot of hip pain along the sides too. So the other way of doing a piriformis stretch is doing something called pigeon, which a lot of people have heard of with, just do it on the bed here, in yoga. And you basically do figure 4, but you are moving your
Do it that one? No.
That's advanced. You can do this, or you can even lay down on your tummy if you want to deepen that a little bit more. So that's a nice way of really getting to the piriformis and the obturator internus. So once you start with some of those resistance exercises, then if you have one of these tools at home, this is one of the tools we carry in the clinic. This is a really helpful tool for working with the pelvic floor muscles internally. So you can do some stretching and you can do some movement, but then we also have this is what it looks like. And you can call us and Michelle can send one to you. You can also order them online. And so what this tool does is it helps access some of the muscles in the pelvic floor. So here's one end, that's where you'd use the tool to enter through the vagina, and then we're trying to access these muscles. So the piriformis, if you've ever had a massage before and they said, oh, your piriformis is tight, the other way to get to the piriformis is through the big glute muscle on the back of the pelvis, and there's a little spot about this big that the massage therapist will get their elbow into and try and relax. But really the piriformis best access point is through the vagina, and so that you can get right up into this area to really relax that muscle. So you would use this tool after you've done all those resistance exercises and stretches first, and you would insert the tool and you would head back into the back part of your pelvis here and just apply some pressure while doing a couple range of motion exercises. So if you have, the easiest way to do this is to put like 5 pillows behind your bed, or behind your back, and be in your bed, and then you insert this into your vagina, and then you bring your leg and you just go out and back. And what that's doing is helping you contract and relax those muscles that are in your pelvic floor that are creating some tension or holding patterns. The other thing you can do with it inserted and also moving around those trigger points is going open and close with the leg. A couple things you want to think about when you're doing these motions is contracting the quad and the hamstring at the same time, so it becomes a little bit more of an active movement versus just a flop out and a flop back. So we're trying to engage these muscles so that we can really support the balance in the pelvic floor muscles. So anyway, I hope this was helpful. I just wanted to give you a few techniques that you could use at home to increase circulation and relax those tense muscles that you might be getting hanging out. Thanks.